All right, guys, we're back with Dr. Niemeyer. He was with us
Hello.
last week and got great response. He was giving us some great information. So we've got some good follow-up questions for him, and hopefully he can help keep us all as safe as possible. So thanks for coming back on, Doc.
Sure, not a problem at all.
All right, so real quick, any crazy new updates, any changes on what we know or don't know on this virus that you can report?
No, not really. I mean, we're I think in Ohio and particularly in Cincinnati, from all the you see them come out these heat maps of showing not only explosion of virus, but also from cell phone data showing who's moving around and who's not. And I think Cincinnati and Ohio is doing a great job of staying at home. And like I said last time, I mean, I think a small sacrifice for a couple weeks or a month is going to save us from having this be several months. So I think in that light, nothing really new on that front. Just keep doing what we're doing, because we are, you hear that flattening the curve. That's been sort of the lingo out there forever, and it's been thrown out in a lot of different ways. But essentially, the thought is we're taking the number of cases we think we're going to get in say a month versus 5 months. We're going to get the same gross number of patients that are going to get sick. So if we can take, just as an example, say 100,000 people are going to get sick, and 100,000 people get sick in a month versus 5 months, we're spreading that out and not overwhelming the hospitals, which it looks like what we're doing. So encourage everybody to keep up the good work. I know it's tough on everybody financially and mentally as well, but we are doing a good job, and that's evident by the statistics.
That's awesome to hear. Now, if people need to go to the grocery store, should everyone wear a mask? Should everyone wear gloves? What should we do?
Yeah, so it's a great question. I mean, I think you saw they just changed the guidelines and they are recommending masks for everybody. We've been doing that at Christ Hospital. Our leadership, particularly our infectious disease docs, all Christ Hospital sites have required everybody in those sites to have a mask on for the last 2 or 3 weeks. And basically, what we know about this virus is it looks like anywhere from 25 to 50% of people, 50%, of people can be either very mild symptoms or asymptomatic with no symptoms. So the reason that we're having people wear masks now, I think that's a good idea when you're out and about, is that you may be sick and not know it and spreading virus. So, the masks by all means don't keep all of it in there, but if you can maintain 6 feet apart from everybody and you're wearing a mask, we can cut down even more than we're already doing the transfer. And I think that possibly 50% of people that get infected will have no symptoms tells you the importance of not only the social distancing, staying at home, but as well as wearing a mask, so that if you are sick and don't know it, particularly allergy season, you may be a little cough and sneezing, and wearing a mask will help you to prevent you're coughing on somebody else. And then the other thing it does, I think there's a good and a bad side to this. Wearing a mask will prevent you from being out and touching your nose. Now, masks are uncomfortable if you're not used to wearing them. Most people in the dental and medical profession, we wear masks all the time, so we're kind of used to it. They do kind of itch and you adjust them, but you're still not touching directly on your mouth or nose. And so it provides sort of 2 levels of control there.
That's a great point. I'm glad you brought that up. Now, hand sanitizer, old-fashioned hand washing, is one better than the other? What are your thoughts?
Yeah, I think so. 2 things. If you assume that everybody's doing it exactly correctly, I think they're equal. However, I think everybody knows the 20-second rule for hand washing. I think the sanitizer, people don't always use the correct amount. They're kind of just squeezing it on and doing this. So, what happens is either one is good. This virus is basically a hollow ball, and it has to have that hollow ball be intact to infect somebody. The hollow ball, basically the outside of the ball, is made of lipids or fats, and any detergent, any soap is going to break open that layer and render the virus ineffective. Alcohol does the same thing. The bonus you get, if you think about it from a perspective of hand washing, is then if you're breaking open that ball and rendering it ineffective, you're then washing those particles down the drain. In theory, with hand sanitizer, if you use the correct amount for the correct amount of time and get all the nooks and crannies, it'll kill everything, but you're sort of leaving those particles on there. So for me, being in the medical world, I'm probably a little more anal than most people in terms of hand washing. particularly with a microbiology background, but I wash whenever I can. That's my go-to. If I'm in a pinch, I'm in the car, something like that. I use hand sanitizer a ton as well. I will use hand sanitizer in between patients, but then I always will wash when I get a chance as well. So that's my preferred go-to. Again, used in the correct way, in the correct manner, they're both equally as effective, just from a perspective of sort of breaking open that ball, so to speak, from a viral perspective, which renders it non-infective. But hand washing is the go-to, and that's true for any infection, really, any kind of bacteria, virus in general.
That's good. I love that analogy that you gave. That hopefully that gives people a visual on kind of what they're trying to accomplish when they're cleaning their hands.
Yep. So friction is good. You want to make sure. I think that's the thing. There's some really good hand washing videos out there, but you just want to try to cover all the nooks and crannies. I've been telling everybody, keep your fingernails a little shorter than you normally would, particularly women. You get a lot of dirt and stuff under there, and that's obviously where the virus can hide. So keep them a little shorter. Make sure you're getting in there. There's a ton of videos out there on different songs you can sing to hit the 20-second mark, whichever one floats your boat, so to speak. From that perspective, I don't care, as long as you're doing it. And again, it's breaking that open, making the virus non-infective, and it'll wash it down the drain then. And then hand sanitizer is great. I think that I would always tell people, use a little more than you think rather than less than you think, and get it all over. Just pretend like you're washing your hands, do the same exact process with hand sanitizer, and either one should be fine.
Okay. Doc, that's great information. If it's cool with you, we're going to keep calling you, keep having you back on here. I know people are loving the updates.
Not a problem at all.
Hey, Eric, stay safe.
Thank you very much. Everybody else too.
Thanks. That was good, man.
Yeah. No.